This is just the beginning.
Welcome to What's at Stake in the 2020 election. I'm Margaret Toller, the White House and Politics editor for Axios, and I'm coming to you from my home in Washington, D.C. I'd like to thank our sponsor, PBS and Frontline, for this event, and we hope you'll follow along using the Axios Events hashtag and @Axios on Twitter. Welcome also to our live stream audiences from Facebook, YouTube, Twitter, LinkedIn, and of course, the Axios website. Over the course of the next 30 minutes, we're going to have 3 segments together talking about the lead up to the election day. We'll explore the Trump and Biden administration's positions on everything from healthcare to the economy to the COVID-19 response. And of course, what will matter after November, regardless of who wins. For the latest news on these subjects, please follow our dashboard at Axios.com. And now, our first guest represents California's 17th Congressional District, Congressman Khanna, joining us from Washington, D.C. Congressman Khanna, hello.
Margaret, it's great to be on. Thanks for having me.
When I think about this election and the pandemic, I really feel like 2 of the biggest issues that come to my mind are healthcare and the economy. And I'm wondering whether you see these also as the biggest issues driving the election.
Absolutely. I mean, I think the first thing this has shown is your healthcare shouldn't be connected to your job. If you believe that every person has inherent dignity, how can you say that the type of job you have or the fancy title you have should determine what kind of healthcare you have, especially when we're all interconnected? If one person gets COVID, it affects all of us. And the second thing is the economy. And what has been highlighted is those doing the essential work, those who are stocking warehouses, those who are cleaning our buildings, those who are preparing our food. They are on the margins of an economy that has benefited the coasts, that have benefited investors. What are we going to do to really build a middle class, a working class in this country?
And there are clear differences between President Trump and Joe Biden. We know that President Trump wants to end Obamacare. He wants to replace it with something that he keeps saying is coming out in 2 weeks. We haven't seen it yet. Biden wants to preserve the Affordable Care Act, but he also wants to keep private insurance. And this is a real fault line inside the Democratic Party. You're among those progressives who actually voted against the party platform over the summer. It doesn't call for Medicare for all. Do you think that the current private insurance system is going to end up being sustainable if Joe Biden wins once the full impacts of the coronavirus are really felt?
Not in its current form. I mean, it's important to realize Medicare for all, what it says is that the basics of Medicare should extend to everyone. Medicare allows for supplemental private insurance. I mean, if you're a senior and you have Medicare and you want to get additional insurance, you can do that. But what we're saying is that the basic health care in this country should be available to everybody. Now, if they want to get things that are non-duplicative on top of that, they can go ahead and do that. I believe that this is going to become more and more obvious to Americans. Already the polls show that. Vice President Biden has said he wants to extend Medicare till 60. And I think there's going to be a real push to continue to extend Medicare until it covers everyone.
What do we know so far in terms of how the pandemic has impacted people's health care? There was sort of an initial stimulus. Congress has stalled in trying to reach subsequent extensions of additional benefits. And what do you really see as the reckoning? Do we know how many people are affected yet? How long do you think it'll take to really understand the long-term healthcare impacts of the pandemic?
I think that's devastating. I mean, we know that millions of people have been affected in terms of having been tested positive. We know that a lot of people have had hospitalizations. We know that people have been affected, even those who didn't have COVID, because they don't have the same care for other diseases that they may have. And we know that even middle class, upper middle class professionals who have lost their jobs or are without health insurance are now seeing how costly and how cruel the private insurance system can be. So I think that this is why people are going to say everyone should have basic health care from the day they were born, and it shouldn't be dependent on your job.
It sort of sounds in that sense like the pandemic is creating an opportunity. I mean, I don't want to be like crass about it. Obviously, it's an overwhelmingly terrible thing. Nobody would wish a pandemic on a society, but you're in politics. You have to take your opportunities when they come. Do you see that this is a window of opportunity to kind of break the model on stuff that's been politically untouchable in the past, and other than extending Medicare coverage? What do you see as some of those things?
I think the pandemic has reminded us of our shared humanity with other American citizens. It's no longer possible to think, oh, we're not part of those who get sick. Now we know, almost everyone knows, unfortunately, someone who has been hospitalized, someone who had a serious bout with COVID. And think about that. Almost all of us now as Americans have had a real experience with the healthcare system about something very serious. And now almost everyone knows someone who's lost their job or maybe lost their insurance. It used to be that was a group of people we didn't think about. So because I think there is a greater shared understanding about the vulnerability of people who lose their jobs, the vulnerability of people who don't have health care, I think that's created the groundswell for support for Medicare for All, that it includes people who are in the professional class who may not have thought about it before this pandemic.
This all costs a lot of money, as you know, and that's one of the reasons why there have been political objections. In years past, we have an audience question. Audience member asks, other than raising taxes, are there other ways to fund the massive additional spending that Joe Biden has proposed? Where does money come from as you see things looking at the year ahead?
Right. Well, first of all, our federal budget, it's important to start out with the fact that 53% of the discretionary budget is defense. And Trump has increased the defense budget by $140 billion from where Obama left it. We don't need all of the modernization of nuclear weapons. We don't need all of the handouts to defense contractors. We don't need Air Force aircraft carriers that are going to not be sustainable in modern warfare. So there can be strategic cuts in defense that pay instead for free public education, that free college education, that pay for basic increases in nutritional programs. And in terms of Medicare for All, a lot of that is healthcare reduction of costs. I mean, you're taking out administrative costs. You're taking out a lot of the private insurance, rent seeking. People say, well, it's still going to cost more. One of the reasons it costs slightly more is because more people are going to use healthcare. And so they factor in higher utilization to say it costs more. But that's going to mean more jobs created in the healthcare. And that's going to mean everyone has better healthcare. And we're going to take out a lot of the rent-seeking behavior. So it's going to be a more efficient system.
None of these debates are likely to really come to a head unless there's not just a Democratic president, but Democratic control of both chambers of Congress. We're still several weeks away from the election. If the election were today, how do you see that vote going? What do you think are really the pivot points in what voters are going to be deciding on? And people are casting their ballots now. What do you see as the real decision points on which this election is going to turn?
I think it's going to turn on two things. One, COVID-19, and two, the economy. COVID-19 is going to matter because, unfortunately, this virus is going to be with us for the next 6 months to a year, no matter what the president says. So people are going to want to make sure that whoever is there next is going to be responsible, who's going to listen to scientists, is going to take appropriate actions, is going to make sure that the vaccine is safe and equitably distributed. And that's, I think, why Vice President Biden has such an edge on that issue. And then the economy. Who's going to make sure that the economy is rebuilt, not just for Wall Street, not just for the stock market, but for the broader working class and middle class? And I think the same issues are going to determine Senate races. And I'm quite optimistic that it's going to be very close, but I think there's a clear path for us to take back the Senate majority.
What's your sense? There are a couple of swing states that have older Americans, that have significant Latino populations. Do you have a sense about which swing states are going to change from 2016 and why? What has happened in this country since 2016 that might cause Florida or an Arizona to change its stripes?
Well, both of those are very encouraging. The polls are encouraging. Mark Kelly is a terrific candidate who I'm pretty confident will win the Senate seat in Arizona. you have there an elderly population that really has been discouraged and frustrated with the president's response. You saw initially approval for the president's response, and then those numbers decline because of the statements he's made, because of the cavalier way he's treated the epidemic. And so I think the elderly voters, the older voters will come to Biden and us. And I think we will win back the Hispanic vote. I mean, we have to do a little better to get up to Clinton's percentage, but I think we will do that now that there's a full-scale effort to mobilize that community. Bernie Sanders showed that it could be done.
Anything I haven't asked you, looking ahead?
Well, I would just say that this is a historic election for the Democratic Party. We could win both chambers of Congress and the presidency and really start to drive an agenda to lift the working class and communities left behind. And we can't leave anything out and regret not giving everything we have to the election. So it's going to be a turnout election. If we mobilize, we will win.
Congressman Ro Khanna, thank you so much for joining us here at Axios.
Thank you. Really appreciate it.
And thanks to our sponsors, PBS and Frontline. Up next, we have A View from the Top with our CEO, Jim Vandehei, and the filmmakers of Frontline's The Choice 2020, Trump versus Biden, Michael Kirk.
Thank you very much, Margaret. I'm now thrilled to have a conversation with filmmaker Michael Kirk from The Choice 2020, Trump v. Biden. Before we plunge into a conversation, we're going to show you a quick promo.
Hello, I'm Paula Kerger. Thank you for joining us for what we know will be an inspiring conversation. This is a special year for PBS, our 50th anniversary, as we mark 5 decades of service to the American public. Ever since our founding, PBS has been a trusted destination for news and public affairs programming, as well as the best in documentary film. Building on that strong legacy, we are delighted to reprise Frontline's The Choice, which has provided an up-close look at all of the presidential candidates since 1988. We look forward to sharing this extraordinary film with audiences on September 22nd on our broadcast and digital platforms. And we are so grateful to the many individuals, corporations, and foundations who support our work, including, of course, the support of viewers like you. And so now let's take a look at The Choice.
We are taking back our country. The battle for the soul of America.
As America faces an historic choice.
Coronavirus explosion. We bad these unemployment numbers.
Protests against police brutality.
From Frontline's award-winning political team, the election year tradition critics have called a fair and humanizing look at both candidates. The Choice 2020, Trump versus Biden. Tune in or stream Tuesday, September 22nd, only on PBS.
I'm now joined by Michael Kirk, the filmmaker behind this. Michael, this is the first film that PBS has done in this series that was done amid a pandemic and done remote. Like, how did you do that? How did you pull it off? How does a filmmaker film a film from home?
Especially when what you want to do is, this is my 5th choice, and you want to match it in terms of quality. You want the picture quality to be good. You want everything to feel as if it was not in the middle of a pandemic. So practically speaking, we built a single camera kit that we could send to people, and 50 of them generously allowed us to ship it to their house. People like Fiona Hill and others opening it up. You can imagine walking around with a camera, figuring out where to stand and where to sit. And then I would hop on Zoom and interview them at great length, sometimes a couple of hours long. And then it would get sent back to us in Boston and we'd put it in the box. So you had that, and you also had the weird and nervous energy of this huge crisis, both the pandemic, but also the racial reckoning and other things that are happening now. And in the middle of it all, you're trying to figure out how to make a film about the crisis and about the crisis in each one of the 2 guys and how they might respond to it. So it was, let's say, challenging at least.
And you've been doing a lot of these films. You're a student of both filmmaking and presidential campaigns. These are 2 very known men, right? They've been on the public stage for a long time, and yet you've marinated in their life stories for the last several months. What did you learn? Like, what surprised you most as you plunged in to their minds, their worlds, their lives?
Every time we do this, we bury ourselves inside the materials, as you say, Jim, marinate ourselves inside of it, and we're always looking for something unique. Both of these guys, 50 years in front of cameras, 50 years on the record. How can we conceivably bring up something that and discover something that everybody doesn't think they already know? It helped that we were in the crisis in this sense. It gave us an organizing principle. 8 sequences for each person, woven together. That's the great trick of the choice. We weave the biographies together. So imagine 8 different moments, crisis moments in the lives of these 2 guys, as we try to reveal something surprising about what they gathered along the way. What a crisis like the death of Joe's wife, or his stuttering, or the failure of Donald's casinos, or his time on The Apprentice. What did it give him? What is the man carrying with him as part of his life method as a result of these moments? So you confront somebody with a crisis in each scene, and the crisis is told by people who were there and around there. And then you reveal the resolution, which is, what did they pick up from it? And I'll tell you, it's like reverse engineering their lives. It's just amazing when you watch the scenes happen and you say, that's where Biden gets that. That's why Trump does that. And that's the great eye-opener of the choice. And it's the promise of the choice every 4 years.
What's a good example of that with Trump, right? Because I feel like he's like the most transparent person ever, because he says everything that's on his mind and says it in public. Often, like, what did you see where you're like, now I kind of get the root of that behavior?
Here's the thing, Jim. It's just amazing. When we did the casinos in Atlantic City, and we'd done the choice 4 years ago, so we thought we'd covered a lot of this, but we went deeper because of the crisis idea of hooking everything together around a crisis. In the casino business, he's being warned by experts everywhere, from Wall Street to people in the press. You can't make it with 3 casinos. You can't make it with $1 billion bet on the Taj. And he ignores the expert advice. He's been schooled by Norman Vincent Peale into positive thinking, visualizing positively the world. And when you watch this in action, his dad taught it to him. His dad was a big adherent of this positive thinking idea. And Donald, who was always playing for an audience of 1, even now, his father, is filled with this as the casinos go down and everything falls apart. And he has resisted any expert opinion right to the bitter end. When we play what we do, which is the coronavirus stuff at the very end of that scene, and you see him talking about only 15 people, it's going to go away, we've got this. It's just exactly the way he played the casino crashes. There's just something in the makeup of what the guy learned from all of that, his dad, the whole thing, the business stuff before that emerges then and emerges even in a finer, more highly developed way as president of the United States during the coronavirus crisis.
Such a cinematic dimension to presidential races. You were able to talk to 50 plus different people that have touched the lives of Biden or Trump. Who is the most original, interesting, captivating character that you came across?
It's a funny thing, there's of course, we've all heard of Mary Trump, and we all think we heard about it. The interview was amazing. This interview, she's had time. We're looking for a different thing. We're not looking for a headline. We're looking for a character-driven arc of narrative. She plays the game. Bolton is amazing. John Bolton, I never thought I'd say those words out loud, but John Bolton is an amazing storyteller about a lot of things that were going on in there. Those are great, fun and interesting interviews. The people who know Biden really well, his sister and his wife, second wife, are not the typical family spokespeople. I know they're there to be surrogates, but they get into it and they start playing the crisis issues with us. And there were real revelations. And then on the side, Angela Wright about Anita Hill, the woman who didn't get to speak about what happened with Clarence Thomas. Very interesting interview there. And in the Trump Central Park 5, Yusef Salaam. Very interesting sort of side vector in to what was going on there at the very earliest days of Donald Trump and his view on race and racial strife in New York City.
I love your enthusiasm for the film, love your enthusiasm for the characters that you're able to tell a story about. Good luck with the film. PBS has such a great reputation with this series for giving people time to breathe and think about the candidates, think about the choice, and do it with fairness. So I look forward to seeing the success of this film. I hope it enjoys the same success the previous ones have had. So thank you, Michael.
Yes. Thank you very much.
Thanks, Jim. Our next guest is joining us from Carmel, Indiana. Representative of Indiana's 5th Congressional District, Congresswoman Susan Brooks. Congresswoman, hello. Thank you so much for being with us.
Good morning, Margaret. Good to be here today.
As we look ahead to the election, obviously the economy and healthcare are driving a lot of what voters are worried about and thinking about, a lot of what Congress is doing. And you are an expert in particular in biodefense. You launched and co-chaired the Biodefense Caucus a couple years ago. I think everybody, probably you, also thought at the time it'd be pretty heavily focused on chemical and biological attacks. But now, of course, we have a pandemic. What has the pandemic shown us about the U.S. biodefense needs and preparedness?
Congress has been focused actually on preparedness for decades. There became a particular focus after 9/11, where our country, in a very bipartisan way, members of Congress came together and passed pretty landmark legislation called Pandemic All-Hazard Preparedness Act. And then we have built on that framework ever since. I reauthorized with Anna Eshoo of California, the last reauthorization of what's called PAPA. And that is trying to continue to improve our country's preparedness for what we really had always focused on were those attacks, as you mentioned, a terrorist attack, whether it was a biological attack, a chemical attack, radiological, or nuclear. What we've learned is that our things like the Strategic National Stockpile were really not adequately supplied to be ready for a very long incident or episode of a pandemic, which we clearly haven't had in our lifetime in 100 years. And our states weren't really prepared with their stockpiles, if they even had stockpiles, to be ready to deal with this pandemic. So many, many lessons we're learning along the way. But I want the country to know, most people didn't even know the Strategic National Stockpile existed, but it did exist prior, filled with many pharmaceutical products and therapeutic products. But when you have a novel virus like this COVID-19, there is no vaccine. There are no therapeutics necessarily that we know to be in the stockpile. And so that's what, thanks to our incredible pharmaceutical companies and diagnostic companies and device companies, and luckily we have the best in the world, they are really rising to the occasion and working at unbelievable speed to try to bring vaccines and therapeutics to put in those stockpiles. And same with the PPE. We learned that we didn't have enough PPE for something that was going to last this long.
The legislation so far really has focused, or at least in terms of, I think, how the public reads, it really has focused in terms of stimulus, emergency stopgap support. Are there steps that Congress is taking now or needs to be taking in the months to come to beef up not just sort of the stockpiles that we've been talking about, but other preparedness steps in terms of future pandemic, either future pandemics or future kind of man-made or terror-triggered attacks that are biological in nature?
Yes. So besides the fact that Congress had been beefing up for years the appropriations for preparedness, it certainly was not enough. And we recognize that. And so through the CARES Act, trillions of dollars of funding has gone toward beefing up our healthcare preparedness. I think that's been one of our greatest concerns, is how prepared are those frontline workers? Do they have what they need to be able to care for patients? So I do think going forward, and I certainly hope in a bipartisan way, we will come together to make sure that there is more funding for those frontline workers, for our healthcare systems, that we can beef up our local health departments, public health in our communities, our local county health departments, our state health departments, quite frankly, have not been adequately funded over many years. And so I think there's going to be a lot of discussion, not only in Congress, but I think in state legislatures and in county commissions and so forth. How do we make sure that we do a better job, not only in the long-term future, but because pandemics can last sometimes a couple of years, how do we do it now? How do we increase the funding that our local health officials have, that our schools have, and that our health professionals need? Our first responders who are going out and, into homes and into business places, how do we make sure they're prepared?
Congresswoman, you are retiring after this term, so maybe you can speak a little more freely. What's your assessment of President Trump's handling of the pandemic so far, and why can't Congress seem to get its act together on passing another stimulus front?
Well, I will start, since I just left Washington yesterday. I am really very hopeful that we will come together. Obviously, the two sides have been very far apart, but I think from what I'm seeing with the Democrats really pressuring Speaker Pelosi to really come off that really high number and to try to focus on things that are so critically important. We have got to make sure that our young people have broadband and have connectivity. We've got to make sure that our local governments have funds to help families from becoming homeless. There is so much, and that we are feeding people who are hungry. There is so much need out there right now. The Paycheck Protection Program really did work. And I've talked to so many businesses that it really did work. We need to replenish that Paycheck Protection Program to keep people employed. We had the lowest unemployment before this pandemic hit of 3.6%, I believe. And then we soared into unprecedented numbers. Those are coming back down, but we've got to do what we can to get people back into that workforce. So I think in a bipartisan way, we know that the country needs help. I am so hopeful that our leaders come together and can find a way forward, and they need to do it quickly. I think, President Trump I do believe he's relied on the science, but the science has changed. It has changed from the beginning of COVID, when we were told by health professionals that masks really weren't necessary at the beginning because they were trying to conserve the masks for the health professionals, to now masks being one of the most important ways to prevent the spread of this disease. And so our health professionals have changed in their advice from the very beginning. And I think that's been the most difficult piece, is that people have struggled as to what to believe, who to believe, when to believe, while the entire, the narrative has changed as to what we need to be doing. But we do need to be masking. We need to be supporting all of the scientists in bringing those vaccines that are going to be coming in the next few months. And then we need to make sure people do get vaccinated, because that is what is going to change our trajectory going forward. That's what's going to make us safer.
Would you like to see him step back and just let the scientists do the talking when it comes to the vaccine and readiness and timing?
Well, I think the scientists have been there, from Dr. Fauci to Dr. Birx to Dr. Redfield, Dr. Hahn, FDA, CDC, all of these various institutions. I do believe they need to continue to be out front speaking, but the president, as the head of our country, as the head of the most important position, I believe, in the world, needs to be sharing what we're doing. I believe he does support the science, and I believe the coronavirus task force is working diligently, is still critical in how we respond. And I think we are going to get through this, but the president does need to make sure the country is moving forward, is not panicking, is on a positive path forward, and that we're all doing our part.
As we go, you're a Republican, but you've always been well known for working across the aisle, consider yourself a problem solver. Do you think that's going to get harder or easier after the next election? And I know that you do some work with the modernization of Congress committee. What can we see from you guys now or next year after you move on?
Well, this is a bipartisan committee, really proud of its work. We're going to be rolling out our recommendations in the next week or two and hopefully being adopted. And it's about improving civility. We know that's important. It's about getting budgets passed. It's about improving the technology in the House and keeping our incredible staffs. So I'm very hopeful. It's a great way to end my term in Congress. Very hopeful that particularly with what the country's going through, that we can demonstrate that we can pull together as members of Congress and get the country through this.
Congresswoman Susan Brooks, thank you for joining Axios today.
Thank you, Margaret.
And thanks to our sponsor, PBS and Frontline. Thanks all of you for joining us this afternoon for another virtual conversation that's made all of us smarter and faster. If you liked this conversation, check out our News Shapers America's Road Ahead series. These will be 5 events starting October 1st and following each debate through the election. This concludes our program.